Good afternoon, this is Dr. Ralph Joseph, and I'm going to show you the procedure for doing hormone pellet insertion on a female. First of all, this procedure starts off as a non-sterile procedure and it becomes a sterile procedure. So your landmarks are the top of the iliac crest, and then you're trying to go medial, and in patients, it's who have had procedures in the past, you can actually see the scars. And usually what you'll see for me when I'm doing these, there's actually one here, there's one here. I'm actually going to put one right there in between. And then the next time she'll go to an opposite side. And then when she comes back in 6 months to get her next set of pellets after her opposite side, then I'll start going just opposite of these procedures as I go more lateral. So you do an alcohol prep. I always put this to the top so I know where my landmarks are. I use ethylene chloride spray just to numb up the skin. I tell the patients that when it works, they're going to have some stinging right now, and it usually makes a small little ice ball. Then you start out by making a small little wheel. Use a 30 gauge half-inch needle. And when I'm doing my numbing, I use anywhere between 8 to 10 cc's of 1% local anesthesia. I usually keep my thumb here so it gives me more three-dimensional approach. And so I start out by numbing just the skin, then I go deep. And when I go deep, I'm trying to actually hit the muscle here. This is an important thing. So if you bend the needle a little bit, as you're coming straight back out, you'll either feel this or see it pop. Then you'll see the skin release, and when it does that, then you know you're between muscle and skin. That's exactly where you want to be numbing up. Remember, I'm using this as my landmark, and over time, you're going to have this technique where you can just come out, and then as you go in, just inject. Come out, inject, come out, inject, okay? And if you do that over time, you'll be able to keep the same anatomical approach when you're doing your insufflation of local anesthesia. And a lot of times what you'll see is it'll start out red and it'll become blanched around that because of the epinephrine that's in the lidocaine. The good thing about that is it also reduces the bleeding on this procedure. A lot of times you're able to actually palpate this area and you know it's a little bit more dense to palpation, okay? So that way you know that you're in the right place. The last thing I always tell when I'm doing training is that if you look at your needle at the end of this procedure, if it's straight, you know that you've been in the right place most of the time. Take your exam gloves off, and then you start your sterile part of your procedure. This is a reusable tray set, which basically has a 4-inch sterile bowl, a sterile medicine cup, a set of sterile pickups, and a reusable trocar. Always have my nurse drop a number 11 scalpel blade onto the sterile field. The remainder of the procedure now has to do with continuing your sterile part. Put your gloves on. And then some of the tricks that I've learned over the years is if you take the whole tray or your exam bowl and you put it right next to the patient, if you drop a pellet, most likely it'll go straight in that bowl. And if that happens, then you don't have to worry about trying to leave the patient's bedside and trying to get another sterile pellet. So basically the procedure is taking your scalpel, find your area that you've been numbing up. Okay, you go straight in, straight back out. And you can see this is in line of the previous procedures. You take your trocar with this bevel side up. It goes in just toward the bevels right at the skin, and you'll feel a little bit of relaxation there. You pull up, straight up, and it should just go straight in without any resistance. And if it does that, then you know that you're in the correct area. I take my pickups and I start putting the pellets inside the trocar sheath here. I always push them all the way in. Then you take your blunt introducer straight in. Then you pull the whole thing out and cover the incision. This is a 1/4-inch steri-strip, and if you put it on by going on one side and pushing up to the other side, that actually closes the incision. And then basically, that's now a closed incision. Put a piece of tape, this is 1-inch foam tape over the top of that. This stays on for 3 days, and always tell the patient to keep this on for 3 days. You put a dressing over this by taking a 4x4, fold it in half. Cover this area. I always tell patients, tomorrow, take a shower, get this really, really wet, and then pull this off and leave the tape underneath. Make sure that they're informed that they don't get any kind of strenuous exercise for the next 3 days, that they don't get into the ocean or the lake, and that after 3 days they can take off their dressing. The other thing is we always give instructions to the patient on what they're supposed to do and what they're called for post-op. We usually see the patients back for either follow-up labs, depending upon how many procedures that they've had, okay? And we always talk to the patients about their symptoms. And that concludes the insertion video for this particular patient.